Okay, so let's begin, guys. Let's begin. And any doubt, just keep putting it in the chat box, right? And I'll be able to answer after it's done, right? And as I said, we'll be sharing some discount coupons as well. So stay with me. Yeah. Right. So PLAB-2 UKMLA. First of all, I know like you guys got the results like day before yesterday. So first of all, I would like to say congratulations, right? You have done the first part. Now you'll be able to do your second part, PLAB-2 UKMLA with us. Yeah. So welcome to Aspire Academy. And I would say the Aspire Academy was founded by I, Ankur Garg, and Dr. Nikhilesh. So that's me. I know it's modern era, so we have to have these kind of photos, yeah. Okay, so we are the main tutors, but then you will see other tutors as well when you will be joining the course. But we do take most of the classes. For example, ethics, some of the medicine examination, I'm going to teach prescription, SIMMAN, you'll see Dr. Nikhilesh will be teaching, right? So, yeah. Now, what PLAB-2 is all about? First of all, I would like to say this is an OSCE exam, objective structured clinical exam. So you're given like hundreds of exam in your life. You're doctors, so you know, like every step of our life, you have to give exams, and you're given so many. But I would say this PLAB-2 is different. PLAB-1 was saying like MCQ, and you are done with that. Now, PLAB-2 is an OSCE exam, meaning what's going to happen? You need to do the consultation. So you'll have actors there. You will not have real patients. The thing is, you'll have the professional actors, professional simulators, and they will be having a script, and they will be giving you the history. So you need to take history from them, make the diagnosis, and treat it accordingly. So that's how it works. So what is going to happen? You'll have 16 stations. So you'll have 16 different patients. You'll have 16 different actors in the exam, right? And the exam is time bound as well, right? So each station, what's going to happen? You will be given 8 minutes. So you have 16 stations and you'll have 8 minutes for each station, right? And what's going to happen is they will be giving a task to you outside. So you will read that task, and the task will have a bit of information about the patient, and they will tell you what are you supposed to do in this particular scenario, right? So you will be given 1 minute and 30 seconds to read that task. So I would say 8 minutes you're going to get with the patient, and then 1 minute 30 seconds you're going to get outside the cubicle. So you can say roughly 9 minutes and 30 seconds it's going to take for one scenario. You have got 16 scenario, but you have got 2 rest stations as well. Because it's not easy to talk for that long, isn't it? I mean, one station is going to take 9 minutes and 30 seconds, and you've got 16 scenarios. So it's roughly going to take 3 hours. Now tell me, can you talk for 3 hours? It's not that easy. Can you talk for 3 hours with full concentration? That is not easy, guys. That's not easy. It's a challenge, I would say, right? So that's why they've got 2 rest stations as well. So in the rest station, obviously, you can have a glass of water, you can have a cup of coffee, you can use the restroom. So that's something that can be done, right? So in total, you'll see there are 18 stations, 16 plus 2 rest station, and each station is going to last for 9 minutes and 30 seconds. 8 minutes inside the cubicle and 1.5 minutes outside. 8 minutes inside the cubicle and 1.5 minutes outside the cubicle. So this is how it is gonna go, right? Okay, so what happened is what kind of consultations you're going to get in this exam. So you'll have history station, history like medicine, surgery, gynae, pediatrics, psychiatry, everything is going to be there. Then you have a lot of counseling station. You'll have some ethical stations as well. You'll have examination, mannequins, teaching. Then SIMMAN. SIMMAN is a mannequin which talks actually. It's a very fancy mannequin, I would say. Prescriptions, you have got the hospital prescriptions as well. And then you have got the tele and video consultations as well. So in some of the stations, you will see like when you enter into the cubicle, you may not have the patient, but you have a camera. So you just look into the camera and the patient is going to be there in front of you on the screen. But sometimes they don't have that camera as well. It is just an audio consultation with the patient as well, right? So everything is going to be there in these 16 stations. It's a mix of everything, right? Okay, so can I access this recording after the meeting? Yes, I will send you the link, doctor, if you just come in the WhatsApp group. If we had OSCE back in our school, is it basically the same? Maybe a bit different. My OET is going to expire on 27th of Jan 2026. Can I still go for PLAB-2? Yes, you can go for PLAB-2, doctor. Yeah. Do we need to have valid IELTS for PLAB-2? No. What's Simman? Simman is a mannequin which talks actually. The mannequin which talks. So the thing is, there are speakers and everything, and somebody sitting in the other room, he is gonna talk on the behalf of Simman, right? I've got some videos as well. So if you come in the WhatsApp group, I'll be able to send some videos for Simman as well. So when you see that, I think you'll get better idea of what is this all about, right? Right. The course is I'm gonna discuss everything in this session. So the exam actually, it's actually divided into every station is, I would say, is actually divided into three parts. So we have got data gathering, we have got clinical management, we have got interpersonal skills. So how many stations we have got, guys? 16. We discussed that, right? Each station is of 12 marks. Each station is of 12 marks, which is divided into three headings. Data gathering is 4 marks. Clinical management is 4 marks, interpersonal skills 4 marks. So 12, 4, 4, 4, 12 marks each, right? So this is how you're going to get the result actually. So this is a result sheet. This is how you're going to get the result, right? So they will tell you like for this particular scenario, how much you got for data gathering, how much you got for management, how much you got for interpersonal skills, and how much total you got for that particular station, and what was the passing score required to pass that particular scenario. So nowadays, actually, what's happening is out of 12, what do you think is the passing score? So, it used to be different for different scenarios, but nowadays what's happening, out of 12, if you get 6 marks, most probably you're gonna pass that station, right? So, most probably you're gonna pass that station. So 6. So if you get 2 in data gathering, 2 in management, 2 in IPS, it is 6. So you're gonna pass that station, right? So each station 12 marks, and there are 3 domains: data gathering, management, and IPS, and each domain is of 2 marks, sorry, 4 marks, and in total 12 score, right? And you need to get 6 roughly to pass that station. So every single station, so for all 16 stations, they're gonna give you the marks like that. This is how much you got for data gathering, this is how much you got for clinical management, this is how much you got for IPS, interpersonal skills, right? So this is how the detailing will be done. And usually what happens is in our exam, they're actually marking us on these criteria. They are checking how our consultation is, right? How is the pass score decided? So doctor, how you do that per consultation? So data gathering is your history taking skills. Management is your management skills. IPS is how you're gonna make your patient comfortable, right? So I'm gonna discuss that also a bit more detail. Just stay with me, right? And what are the criteria to pass the exam, coming to that as well. So first of all, they are actually checking us on these 10 skill areas, and they're checking how our consultation is, diagnosis, examination, findings, issues, language, listening, management, rapport, and time, right? Let's go a bit more. Let's dive into this a bit more in detail. Consultation. This is positive, this is negative. This is they want us to do, they don't want us to do that. Okay, fine. So number one is a smooth consultation. So they are expecting us to do a smooth consultation. See, any consultation, any history you take, how it's gonna go. Patient has got a presenting complaint. What you're gonna do, you're gonna elaborate that presenting complaint. You're gonna ask associated symptoms. Then you have some, what do you say, differentials. Then you have got past medical history. You have got lifestyle history. You've got social history. So it is a sequence, and they want you to follow the sequence. If you're jumping too much in the sequence here and there, they don't like it. So if it is unstructured consultation, they don't want it. If it is a smooth consultation, they want it, right? So just be careful on that. Issues, recognize the issue. So one question for all of you, answer in the chat box. If you get a patient, are you going to do medical management first or non-medical management first? Tell me in the chat box. You have a patient. Are you going to do medical management first or non-medical management first? Okay. So I've got roughly 10 answers and everybody's saying non-medical. Okay. Now, listen to me. You have a patient who is actually having acute exacerbation of asthma. His saturation is 80. And you're saying, don't smoke, don't drink alcohol, have a good physical activity. Is it right? Not right. So medical first or non-medical first, I will say it depends on case to case, right? So it depends on case to case. So what is a big negative here? If you give health and lifestyle advices to an acutely ill patient, it doesn't make any sense at all. right? So you're a doctor, you need to decide. Nobody's gonna tell you you're doing medical first or non-medical. See the patient. This patient needs medical intervention, do medical intervention. If this patient is non-medical first, go for non-medical first. So depending on case to case. All right. Third is time. Time is the problem, right? Like, first of all, a lot of people ask me why the consultations are time bound. It should like we should have unlimited time for the patient, right? But that's not the case. Even in the UK, in reality, GPs they actually gonna give you limited time in real life as well. So if you go to the GP, one consultation is for 10 minutes only. So in 10 minutes, they're going to take your history, they'll do your examination, they'll prescribe you as well, and they'll send you out from the room as well. That's what they do. So that's why they're preparing us from today itself. So the consultation in the exams are time bound as well. So you're going to get 8 minutes. Now, the problem is, see, you have got three domains, as I told you. You have got data gathering, you have got management, and then you have got IPS as well. IPS is more of how you talk to the patient, right? How you talk to the patient. So how much time you're going to spend for data gathering, how much you're going to spend for management, right? So in real life, 10-minute consultation, but in the exam, doctor, we are going to have 8 minutes with our patient, 8 minutes. So the guys tell me, out of 8 minutes, how much for data gathering, how much for management? Tell me how you're going to decide the time. Out of 8 minutes, how much for data gathering, how much for management? Tell me. 4 5 for data gathering, 4 and 4, 4 each, 8 2. No, we don't have 8 2. Total 8 minutes, doctor. We have got 5 5. No, we have got only 8 minutes here. 3 5 4 4. So I've got mostly 3 5 4 4 5 3. I would say spend equal time. 4 minutes for data gathering, 4 minutes of management. Right? A lot of people, they make a mistake here. They spend too much of time in the data gathering. They spend, like, say, for example, a 6 minutes on data gathering, and then they're not having enough time for the management. That is the worst thing that you can do, actually, right? So 4 minutes data gathering, 4 minutes management. Management is not just telling the things. Management is obviously asking them what exactly they want to know. You have to mention about the examination, you have to mention about the investigation, diagnosis, explaining the diagnosis, medical management, non-medical management, follow-up, warning sign, patient has got some questions, you have to answer those questions as well. So a lot of things to be covered, right? And when we have got less time left, what happens is we start talking very fast and we don't listen to the other patient. Management is a two-way consultation, two-way conversation. You need to involve the patient in the management as well. You need to involve the patient in the management as well. And the basic mistake and the common mistake that most of us do is just keep talking. Don't do that, right? In the exam, what happened is they're going to give you a, a ring bell as well. So what happened is they don't have a actual clock in the room. You are not allowed to wear your watches, and there is no clock as well. So how the time is going to be decided? So what happened is so when you're standing outside the cubicle, you have got 1.5 minutes, right? So after 1.5 minutes, what's going to happen? A bell is going to ring, say, begin. Begin means you go in the room. So you go in the room, you have got 8 minutes in the room. In the room, after 6 minutes, there will be a bell saying 2 minutes left. And after complete 8 minutes, there will be another bell saying move on to the next station. So this is how it's going to work. So no watch, no clock, it's just this timer that you're gonna have in the exam. Okay, perfect. Findings. So our job is to identify abnormal findings or results. So they will give you lots of abnormal examination or investigation findings. So you should be able to identify the problems. Examination. So if you're doing the examination, make sure you're doing the proper examination. Whatever instruments they have given you, make sure you use it proficiently as well, right? Perfect. So they'll be giving you like otoscope, fundoscope. So make sure you know how to deal with it as well, right? What would happen if you do everything in history, data collection correct, but you get the wrong diagnosis, but your clinical management to the wrong diagnosis is also good? Would you fail or the right? So I'll cover that point as well. So, guys, first of all, is it necessary to make the diagnosis in all the station? Will you be able to make the diagnosis in all the station? The thing is, not really. I mean, even in real clinics, you can't make the diagnosis every time. So when you are not able to make the diagnosis in your clinic, what do you do? Tell me. So you'll have a couple of differentials in your mind. You are thinking, okay, I'm not sure what it is. It might be this, it might be this. So what do you have? Based on those differentials, what you do, you investigate the patient. You investigate the patient. So same thing you need to do here as well. In one line, if I have to summarize, they want doctors, they don't want medical student. So when you are in the cubicle, if you behave like a doctor, you'll pass the station. If you behave like a medical student, it is a difficult exam, right? So if you're not able to make the diagnosis, it's fine. It's fine. I can't make the diagnosis all the time. So what I do, I have differentials in my mind. I'll investigate the patient accordingly. I'll do symptomatic treatment. I'll give warning signs to my patient, and I will definitely involve my seniors. That is it. That's what you have to do, right? So yeah. Why do most of the people fail in the first attempt? Who says, doctor, most of the people fail in the first attempt? That's a myth. People pass in their first attempt. Usually, the GMC guidelines simply say 65% of people they pass in their first attempt, right? But if I can give good management in 2 minutes, for example, it's fine, right? See, doctor, what is management? Management is not like you give the management. If I have got 4 questions to ask, when I'm going to ask you if you have only 2 minutes for the management. That is the thing. It's not doctor centered, it's patient centered consultation. I know you can do the management in 2 minutes, but I've got 4 questions for you when I'm going to ask. I came to this consultation because I had got 4 questions. You have ended my consultation and I still have those 4 questions in my mind. What do you think? The consultation was helpful or not? Answer is no. So it is two-way conversation. It's not only what you can tell, it's more about what patient wants to ask as well. Okay, so that's really important. Do you say, I would like to investigate for this and this? Yes. So we are not talking to the examiner. We'll tell the patient that I've got a couple of differentials in my mind. You gave me this history, it's taking me towards this diagnosis. You gave me this history as well, it's taking me towards this diagnosis. So what I'm going to do, I'm going to investigate you by doing this investigation. You're not supposed to talk to the examiner. Everything you are discussing, doctor, with the patient only. Right? Is there an unofficial dress code? And dress code is you have to be bare below the elbow, so you have to wear half sleeve shirt, or you can wear full sleeve and you have to fold it. And then normal trouser and leather shoes. That's it. Yeah. Okay. Management. Just remember one thing, the management plan must include, I use the word must include follow-up and warning signs. So whenever you give the management plan, last 30 seconds, just keep it for these two things. Or follow-up and warning signs, right? How long does the Aspire subscription last? Till you pass the exam, doctor, right? Rapport. Now tell me, this is very interesting. That's very interesting. What's the ideal timeline to come to the UK Aspire course and exam? Let's say I've got exam in first week of March. Doctor, after the course, I would like you to have 6 to 8 weeks of time, right? I'm going to talk about it in a bit more detail. Just stay with me. Yeah. What is Rapport? Rapport is make your patient comfortable. Now tell me in the chat box, guys. Tell me in the chat box, what do you mean by rapport building? What do you mean by make your patient comfortable? How can you make your patient comfortable? Just give me one line, everybody, in the chat box. Let's see. Safety netting is also compulsory. Yes, it is compulsory. Empathy. Okay. Listening to their concern is the most important thing. Establish empathy, satisfaction, empathetic word, being empathetic, good. Okay. Smile. Okay, that's very important as well. Breaking bad news with empathy, greeting empathy, politeness, by being polite, being active listener. That's very important. Privacy, chaperone, empathy, listening. Allow them to ask their questions, acknowledging their concerns, ask, no judgment. Perfect. Lots of good points. I got it. And you all are right, actually. So, we come from a country, all of us, I'm just telling the generalized thing, we don't listen to the patient, isn't it? So what happens is we have to see so many patients in one day. So we don't get enough time actually. So what happens is when patient is coming to your clinic, we start writing the prescription. That's what happened in most of our countries, isn't it? Make sure you don't do that here. You will get enough time to talk. 8 minutes are more than enough, right? So number one thing is listen to the patient, because we are not used to listen, isn't it? We are more of into talking. If in any station, if a patient is talking too much, you're doing very good. And if patient is not talking, make them talk. That's the main thing actually, right? If patient is talking, you're gonna pass the exam. Make the patient comfortable enough just so he or she can be able to talk freely and express how they're feeling. Yes. In the course, are there PLAB-2 simulators with the exam-like setting? In the course, are there PLAB-2 simulators? Sorry? In the course, for example, if I'm teaching, I'll be the simulator. I'll act. Yeah. Is it ever appropriate to interrupt the patient? In exam, do not interrupt the patient. Can I imitate Dr. House and how he conducts himself with patient? Just be a bit careful, yeah. How I know, like Dr. House, so what happened is a patient came, oh doctor, this asthma is killing me. And Dr. House is, are you using your inhaler properly? And the patient is like, do you think I'm stupid? And the patient is like, and the Dr. House is like, no, just show me how you use the inhaler. And the patient is like, this, yeah. So yeah, but maybe a bit, not fully like Dr. House, yeah. Are you planning to run a live course in Dubai this year? Yes, of course. If you've got enough candidates, we don't mind coming there, doctor, right? So, yeah. Oh, is it necessary to find out differentials in every station? Okay, so yes, see, when you do a station, obviously you need to have some differentials in your mind. Either you'll have a diagnosis, if not, then you'll have a couple of differentials. So that's what we need to do. So yes, I would say. PLAB2 mock. I'll explain about PLAB2 mock and everything, doctor. Coming to that. What about the live course in India? So we can do the course in any country. We have got a course scheduled in Turkey, guys, in August. We can do, and I'll tell you the requirements, like what we need to run a course in any country. I'll come to that as well. So listening, make sure you listen to the patient carefully. And you know one thing, pick verbal as well as non-verbal cues as well. What does it mean? See, one thing patient is telling, doctor, I'm having cough, I'm having pain, I'm having shortness of breath. Patient is telling. But a lot of things in this exam you'll see, patient won't tell you, they'll show you. For example, patient is sitting and they're shaking their leg. So that is very important. You just have to mention that. I can see you are shaking your leg. Is everything all right, John? Is there anything I can do for you to make you more comfortable? Anything unusual in the station, if you see, you need to verbalize it. That's the main thing. Yeah. I think the point about the Dr. House patient tells us that the GP didn't show her how to use it. So actually, it's a failure on our part. Yeah. True, 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 true. Yeah, language, and make sure you use the language that is patient's language, right? And we are not using any medical jargons. In many scenarios, you will see like you're talking to your staff, you're talking to your seniors, and it's fine. You can use the medical words, right? But otherwise, make sure you are not using any medical jargons. Yeah. Okay. So the exam task. So I tell you what is the task gonna be looking like. Every single scenario in the exam going to be divided into 5 headings. What are these 5 headings? Like where you are, who the patient is, other information about the patient, what you must do, and the special note. So these are the 5 points you will see in every single scenario. So first of all, where are you? You are FY2 doctor, foundation year 2 doctor. Who is a foundation year 2 doctor? It's an intern actually. So in every single station, we are gonna be intern. Now you tell me how much you know as an intern. As an intern, when I was in my internship, I knew nothing. Yeah, I'll be very honest. So yeah, so it's. I mean, obviously we're done with PLAB 1, so we have got that much of medical knowledge. PLAB 2 is about medical communication exam actually, right? So it's a mixture of both. Where are you? So you are foundation year 2 doctor in rheumatology unit, in GP, in A&E, in AMU, in neurology, in cardiology. So they will tell you which department you are working in, right? Who the patient is. Here they'll tell you briefly about the patient. What's the name of the patient? What's the age of the patient? And maybe what is the presenting complaint of the patient as well. So Stanley Smith, age 45, has been referred by the GP because of the pain in the right big toe. So that's kind of a question they will be able to give it to you, right? Other information you have about the patient. So sometimes they'll say none, no other information. But sometimes what happens is they'll give you some extra information as well. So extra information is like, for example, pain in the right big toe. What comes in your mind? Can I say gout? So they might give some risk factors here. Patient is having hypertension. Patient is taking thiazides. Patient is fond of eating steaks. Patient is drinking beer every day, 3 pints. So all these are the risk factor of gout, isn't it? So they might give you in extra information, or sometimes they say none. What you must do, talk to the patient, assess him, and discuss the management with the patient or with the examiner. So here they are telling you what is your task. right? And the spatial note, patient is angry, patient is worried. So that's how they can give you the station. So these are the 5 points. Every single question, I said 16 stations you're going to have, all the stations going to be divided into these 5 headings. So this is how it works. Yep. In the exam, are we always going to be assumed as junior position? Yes, doctor. In every scenario, you will be in a fight to a junior doctor. Yes. Just acted like I knew everything, but internship helps to learn how to build rapport with the patient, at least in my country, you know. You can know that whole life story by just knowing how to talk. Yes, absolutely. For someone with a clinical gap of more than 2 years, no practice, can we cope up with the fresh graduate or experience 1 year? Doctor, no problem at all. We had a candidate having 15 years gap, and now he's working as a GP in the UK. So don't no worries at all, right? Who is the patient's examiner? Isn't it myself? Who is the patient examiner? Okay, what does it mean? Isn't it myself? Yeah, I mean, you are the one, of course. So when you enter into the room, you have a patient, you have the examiner, so and you. So 3 person are gonna be there in the room. Yeah. Okay, so history. When you start station, how it's gonna go. So I'll just discuss briefly about history taking as well, and then we're gonna go to our courses and all. Could it be different setting like emergency and primary? Yes. So sometimes it is GP, sometimes it's accidental and emergency, sometimes it's cardiology, neurology, different. So you need to manage the patient accordingly. Does gap affect your application later after PLAB-2? If you are currently in the clinical practice, it's okay. But if you have got a gap and you are not working now, so sometime during your job interviews, it might create a bit of trouble because they want somebody who's actually working now in the clinical practice, right? So that's the thing. But if you have had a gap of 2, 3 years, but now you're working, no problem at all. History and the communication skills. Okay, so if examiner missed any examination part that we have done, then I mean, come on, they don't miss, don't worry. And the patient, obviously, they know it as well, so no problem at all. First of all, I think when I asked you about rapport building, somebody mentioned smile, which is a very important point. So greet your patient with a smiley face. Very important. Yeah. In every single station, you have to introduce yourself, you need to identify the patient details as well. So this is how I can start the station. Hello, I'm Ankur, one of the doctors. May I confirm your name and age, please? So your introduction and the identification of the patient is must in every single scenario. And then what's going to happen? We'll start. What brings you to the hospital? How can I help you? So that's how you're going to start your scenario. All right. Does the lectureship or demoship between internship and the PLAB-2 exam adds to your CV? Of course, yes. Any teaching that you have done, it's going to add points in your CV, yes. Is there an examiner present in the room alongside the patient? Yes, guys. Can we go to the laboratory during the rest station? Yes. And yes, you can have a glass of water. You can use the laboratory. That's absolutely fine. No problem at all, right? Now, any history taking you do, what happen is we have got the presenting complaint, we elaborate the presenting complaint, we give you associated symptom, you rule out differentials, past, personal, social history, right? Tell me, how many differentials you think you should be ruling out? How many differentials roughly? In any station, you're making a diagnosis, trying to make the diet. How many differentials this should be ruling out? 3, 4, 3, 4, 3, at least 2, 3, 2, 3. Okay. So I got the answer 2 to 4 differentials. Okay. Now I'm going to give you an example. Because, the thing is, when you elaborate the presenting complaint nicely, so any presenting complaint, when you elaborate the presenting complaint nicely, what's going to happen? You are going to rule out lots of differentials. You're going to rule out lots and lots of differentials. Do you suggest doing observership in the UK based hospital while preparing for PLAB-2? Not really, but once you're done with your PLAB-2 exam, you can go for observership. And during it, no, I would say spend the whole time in preparing the PLAB-2 exam. Yep. Okay, so how many differentials? 2 to 4, you guys said. I'll give you a very good example here. So first of all, the presenting complaint, how you're going to elaborate. If the presenting complaint is pain, we have got a mnemonic that is Socrates that you do. Site of pain, onset of pain, character of pain, radiation of the pain, any associated symptom, time, any time, particular time you have got this pain, any exacerbating and relieving factors, and then the severity of pain. That's what you do, right? And then if you have got a presenting complaint, not pain, but it is cough or shortness of breath. So what we have got? We have got another mnemonic that you can use is OD-para, onset of cough, duration of cough, intensity, progression, associated symptom, relieving and exacerbating factors. That's it. Now we have got the presenting complaint, fits, fall, loss of consciousness, vertigo, dizziness. So we have to take history in three parts: before, during, after, right? So that's a rough idea. Now, this slide, I'm going to cover the whole history taking. I'll take 10 minutes and I'll make your mind very clear how to take history in PLAB-2. Just give me 10 minutes here. Okay. If you have a couple of years gap in the clinical practice, but you are basic medical science PhD that teach in the medical school and have done a number of research in the field, will this affect the duty? No, then it's fine, doctor. Then it's fine. Then it's fine. That's not a problem then. Okay. So how are we going to start the station? So we start like, how can I help you? And always we go for open questions. So what's the difference between open and closed question? Doctor, I've got pain. What is a closed question? Where is the pain? So never do that. So when patients gives you presenting complaint, what do? You simply say, tell me more about it. Open question, meaning you are giving the chance to the patient to talk. That is the main thing. Your aim is to encourage the patient to talk, and that's it. Yeah. Do you offer personalized coaching and all? I'll mention about that as well. How to improve in management? It's fourth attempt. Okay. So doctor, maybe just message me. I'll be able to tell you a bit more in detail. You can just talk to me personally, right? Just a message in the group and the admin will be able to share my number and yeah, or maybe email us and we'll be able to contact you. Yeah. Okay. Now I'm gonna explain through an example. Okay, guys, all of you tell me, we have got a younger female patient having pain in the right iliac fossa. So we have got a young female, say 28-year-old female, pain in the right iliac fossa. Give me your differentials, guys. Give me your differentials. Just name the differentials in the chat box. I'm currently not in any clinical practice. What should you suggest for me? Should I? So you can prepare for PLAB-2, and then you're gonna wait for the result and all, and then maybe during that time you can just join any hospital. That would be better. So I got ectopic pregnancy. Okay. Then I got UTI. Then I got appendicitis. Okay. I got torsion. Amazing, guys. That's good. What else? What else? What else? Okay, so come on, come on. I got one PID. Okay, what else? Pregnancy. Okay, topic pregnancy I've said, so yeah. Oophorytis, appendicitis, ruptured ectopic. Okay. Ovarian intestinal obstruction. Okay. Obstruction. Okay. What else? So I think ileitis. Okay, fine. Tubo ovarian abscess. Okay, fine. I'll take that. Abscess. Okay. Renal stone. Renal colic. Abscess. Okay. Tubo ovarian abscess. I mean, okay. Crohn's, stroma, fine. Okay. So if you go for clinical attachment observership for some time while preparing for PLAB-2, will it help further in the exam? Not really. So I would say maybe after giving PLAB-2, you can go for observership. That might be helpful in getting a job later on. Yeah. Okay. Now, let's see. So the thing is, how can I help you? You always have to ask open question first. Yeah. Midsummer's or ovulation pain. Okay, fine, doctor. That's absolutely correct. Now, what you need to do, I know you want to rule out 2, 3 differentials, right? Number one is when you rule out the differentials, we rule out the most important one. We rule out the emergency differentials. That's the main thing, right? So first question that you always ask is, doctor, I've got pain here when patient says, so you ask, tell me more about it. So what happens is you're encouraging the patient to talk. When you do the proper elaboration of the presenting complaint, actually you have ruled out half of the differentials already. So now what I want you guys to do the Socrates. I've got pain, you do the Socrates. Tell me what you want to know. Then we will try to rule out the differentials. Doctor, I've got pain in the right iliac fossa. Tell me more. What do you want to know? Ask me a question, I'll give you the history. Where is that exactly? It's here, doctor, right iliac fossa. So I'm pointing towards that. Onset, doctor, it was gradual in onset. Okay. When did it start? It started yesterday, doctor. It started yesterday. Character, it's dull pain, doctor. Any other symptom? I'm going to tell you. Severity, it's 5 out of 10, doctor. It is continuous, doctor. It is not radiating. It started in the right iliac fossa. It is still there. Any aggravating factor? Not really, doctor. I'm taking paracetamol. That's a bit helpful. Okay, I'm just doing the elaboration of present income. Okay, now wait. So what I said is I've got dull pain, 5 out of 10, not going anywhere. Now, appendicitis, what happens is your pain usually starts from umbilicus and then it goes to the right iliac fossa. But what I said, it started in the right iliac fossa, it's still there. So it is less likely to be appendicitis. I said pain is 5 out of 10. Do you think it's torsion? I would say it's less likely to be torsion as well. I said it is there and the pain is not radiating to anywhere. Can it be renal colic? Not really. See. What I did, I just did a good Socrates and I was able to rule out so many differentials. That's the main thing, right? Now I'm left with few of the differentials. So when you are done with this, what is your next question? Next question is, first of all, you will do the full Socrates and the next question is there anything else? So I was like, okay, anything else? I was like, I was having fever as well. So I said fever. Fever means what? We are going into infection. So do you think it can be abscess? Maybe yes. Can it be intestinal obstruction? Maybe. Can it be PID? Maybe. UTI? Maybe. Ectopic? Less likely, but maybe. Who knows? So fever. How much was the fever? Anything else, if I ask? So anything else? No, doctor. Okay. Now what you do, you have to try making your differentials. So you can ask, do you have any pain or any burning sensation while passing urine? No, doctor. So less likely to be UTI. Just one question I was able to rule out. Any diarrhea or constipation? No, doctor. Okay. When was your last menstrual period? Doctor, 1 week ago. So a topic is also out. So what I'm left with actually, PID and abscess. Okay. Do you have any discharge coming from vagina? Yes, doctor. Okay, so it's going more towards STI or PID. This is how you have to do things in the exam. And then what you can ask for the sexual history and see if it is going towards PID. If you're thinking it's abscess, obviously later on you'll be doing an ultrasound as well, and you'll be able to make the diagnosis very clearly what it is. If it is, abscess or where exactly it's going. In this station, what I tried doing. So if you see how many stations, how many questions I asked to make the diagnosis, to rule out the difference. How many questions I asked to rule out the differential? Just 2-3 questions. And how many differentials I was able to rule out? I would say 8-9 differential. I asked only 3-4 questions. I asked only 3-4 questions for the differentials, and I was able to rule out more than 7-8 differentials. That's what you need to do in the exam, right? Idea, concern, expectation. I'm coming to that as well. I'm coming. There are a lot of tricks and tips we have got. ICE is the biggest thing. Coming to that as well. Coming. So what you do is, remember guys, 2 questions in the history taking. How can I help you? Tell me more and anything else. If you go with these things, life is going to be easy in the exam, right? Tell me more, anything else. Tell me more, anything else. Tell me more, anything else, right? So, tell me more, and then you anything else, then you ask associated symptom, you rule out some differentials which you have not ruled out earlier, right? So this is the thing. If you know these 4 or 5 points, you will be having your diagnosis with you. And then you have got a lot of questions in past medical history, lifestyle history, social history, and with the help of it, you can find some risk factors, right? But guys, remember one thing, don't spend too much of time in past medical, personal, or social history. It has got too many questions. It has got like 18, 19 questions. Am I supposed to ask every single question? The answer is no. You will ask only relevant questions. You will ask only maybe 4 or 5 questions out of these 18, 19, depending on what your differential diagnosis or what your actual diagnosis is in your mind, right? So just be careful on that. Yeah. And then is there anything else that I should know? Sometime when you've got a good rapport with the patient, even if you're missing something, they'll try their best to help you. Patient's concerned, patient will have the concern throughout the scenario. So whenever you feel it's a good time, answer that concern. If a patient has got a chronic illness, ask one more question. How this illness has impacted your life in general. Impact of the illness on the patient's life, that's very important as well. You're not only treating the patient medically, you're treating the patient overall. That is very important. Yeah. But when you are in the scenario, is it possible that you can't even think of these many differentials? How will I slow down the nerves and think? Okay, so tell me more. Anything else? These are the main two things. And always think for the worst. Hope for the best, but think for the worst. And then ice, ice, ice. This question I always get. If I am a human being, I'm taking history. If I get stuck, what should I do? If I get stuck, what should I do? My only answer to that is do ice. Ice. Okay, I put ice here. Let's discuss ice a bit more in detail. It's really interesting. What is ice? Ice is idea, concern, expectation. ICE is your bestest friend in your exam. So when you get stuck, you don't know what to ask next. Can it happen? A lot of can ask me this question. And first of all, when you practice, when you do enough practice, you will not have that thought block that often. It can happen, but not that often. Whenever you get stuck, ask the patient, do you have any idea what's going on with you? ICE. People ask me where I should do ICE. I would say do ICE wherever you want. Can I do ICE separately, C separately, E separately in the end? Yes. Can I do ICE more than once? Yes. Where I should do wherever you want. For example, patient said, doctor, I'm having blood and cough. I can do it in the beginning as well. Do you have any idea what's going on with you? That's fine, isn't it? See, if I'm having blood and cough for last 2 weeks, do you think I have not Googled it? I have, isn't it? And what Google will tell you if I'm having blood and cough, the Google will very clearly says lung cancer, isn't it? So patient might be having their idea. I is that a very awkward question for us. One of my relative went to the doctor and the doctor asked her, do you have any idea what's going on with you? Are you concerned about anything in particular? Do you think we should do some investigation for you? Tell me which investigation you think we should do for you. And my relative was like, how would I know? I'm the patient. You should know as a doctor what investigation you're going to do. But this is how it works in this country. We do ask, we give importance to the patient. We ask these questions to the patient actually. So do you have any idea what's going on with you? What else you are expecting from today's consultation? Is there anything else I can do for you in today's consultation? So this is quite important actually, right? So ice. Do it whenever you get stuck. Do you have any idea what's going on? Are you concerned about anything in particular? Now, expectation. A lot of people ask me, it looks a bit awkward to ask expectation. What are you expecting from today's consultation? So don't ask it like that. Ask it in a very subtle way. I'll give you a very good example here. Okay, tell me. Uh, okay, so there are some questions. I'll come to it. Will the patient mention the associated symptoms when we ask, are there any associated symptoms? They may not, doctor. It depends. Some patient, they will tell you, some patient, they may not. Would you please share your WhatsApp group link? We'll be sharing, doctor. Then if they are saying ridiculous things, we stay political and don't disregard them. Yes, you have to respect everything what they say. What are the best study material example scenarios? I will share it with you. And how are you coping up with you? Okay, that's fine. Right, so I'll give you an example on expectation. So tell me, what is the management of tension headache? Tension headache. Tell me, tension headache management. Guys, there's a study material in the WhatsApp group. Please, yes. If you come in our WhatsApp group, I'll share you some PDFs as well for our introduction and all. So don't you worry about that. So the management, somebody told you paracetamol, analgesics, NSAIDs, stress therapy, recognizing the trigger factors, reassurance, paracetamol, lifestyle, rest, sleep, analgesics, painkillers, management stressor, analgesic, stress, paracetamol. Amazing. Good. Perfect. All of you got this scenario and you mentioned what you mentioned here. So what do you think, how many marks you should get for management? So the candidate who got it mentioned all those things which you guys have mentioned in the management and got 1 mark in the management. Why? You got 1 mark, yeah. So there is one doctor, Dr. Tabassum got only. So why one? I am gonna give you only one. If you say everything, whatever it's been mentioned here, you'll get only one. You know why? Because you didn't fulfill my expectations. What was my expectation? My expectation was I wanted to have a CT scan. Did you guys talk about CT scan? You're like, no, we don't do CT scan in tension headache. I understand, but I want to have one. Did you have a discussion on a CT scan? You're like, no. So this is the main thing actually. So, you tell the patient, okay, the history that you have given me, it looks like you may be having tension headache, right? So I'm going to tell you the management of tension headache. Is there anything else you are expecting from today's consultation? And the patient is like, I want a CT scan. I can see you want a CT scan. And then you'll have a bit of discussion on the CT scan. And you tell the patient, we don't offer CT scan in these scenarios. And you'll have a bit of discussion on it. That patient is going to be okay. So we don't offer CT scan in tension headache, I agree. But patient wanted to have a discussion. Patient want to have a CT scan. It's a demanding patient. Obviously, you'll say no to CT scan and you tell the patient why CT scan is not a good idea. So that discussion has to be there. So I'm just trying to explain you what is the importance of this word expectation. So idea, concern, expectation. It's very important in every single scenario. You need to mention that. Just bring it up and see where the ball rolls. Yes, that's it. So asking them their expectation and concern is not a separate part, but it's a part of management. Absolutely. Can we reassure with safety netting in scenario that CT scan is required? CT scan is not required in tension attack, and that's what you're gonna tell the patient. Yeah. So ask for expectation and address it. Yes. So idea, concern, expectation is for sure you're gonna do in a station, right? So after history, what we're gonna do? We're gonna go for examination. Some station you're gonna do the examination. Some station you'll just mention it, and examiner might be able to give you the examination findings, right? What he keeps on insisting for CT scan. So you will explain that why CT scan is not required. Then you will tell the side effects of CT as well, like it's unnecessary radiations as well. So there is a way to do it actually. The demanding patient, how not to fulfill their demand or how to fulfill their demand. It's a proper counseling and ethics. We can discuss it maybe some other day, doctor, because it's going to take times, because it's a proper way we have to do it, right? So the patient is refusing your treatment or demanding a treatment. There is a way to convince them actually, right? So after history, we go for examination and initial investigations, right? So for example, we have got a young female patient. Patient is saying, I'm going to the loo more often. I've got fever as well. And I've got burning sensation while passing urine. I've got pain in the tummy here, suprapubic area. What do you think it is? Young female, pain in the suprapubic area, going to the loo more often, fever, UTI. I'm 90% sure it's UTI. Right. So I'll say examination. I would like to do general physical examination. I would like to check your vitals, and I'm going to do your abdominal examination. Which investigation you're going to do? Urine dipstick test. You mention it. Then what do you do? When you mention about the investigation, urine dipstick, then examiner might say, so what we have got leukocytes and nitrates in the urine sample. Then what you can say, you have UTI. So before you disclose and explain the diagnosis, what you should have done, history, examination, and investigation. Based on your history, examination, and investigation, based on these three things, you'll be given the diagnosis. Explain the diagnosis, explain the positive examination and investigation findings as well. So, Maria, you mentioned that you're having pain in your tummy, you're going to the loo more often, you're having fever as well. When I did the urine dipstick test, I found certain kinds of cells were high in your urine sample. That is suggestive of urinary tract infection. So this is how you do. You can ask the patient first, do you have any idea what's going on? Doctor, I'm thinking it's infection. Yes, Maria, you're absolutely right. That's what we are suspecting it as well, right? And what we're going to do, we are going to treat you. So do the symptomatic treatment. Patient has got fever, give something for fever. Patient has got pain, give something for pain. Patient has got vomiting, nausea, give something for that as well. Do not underestimate symptomatic treatment. Okay. If there are any further investigations you want to do, you can do that. If there are no further investigation in that case, that's okay. You can go for symptomatic treatment, painkillers, antipyretics and all, and then specific treatment, maybe antibiotics, right? Antibiotics, if confirmed UTI, yes, we can give antibiotics, yeah. Do you have to tell the findings of the examination and investigations to the patient before disclosing the diagnosis? Yes. Do we not directly? Yes, you will give antibiotics. Obviously, you will give the antibiotics. Now, even in the exam, if you don't know the name of the antibiotic, it's absolutely fine. Just say according to the hospital protocol. According to the hospital protocol. No problem at all. Right. So medical treatment first or non-medical treatment first, guys? Medical or non-medical? It depends on the case. Yeah. Admission. If you're sure about admission, admit. If you're sure about discharge, discharge. But if you're not sure what you're gonna do, you will be able to involve your seniors as well. Right? Don't miss follow-up and warning sign. OTPT reviews, occupational therapist and physiotherapist. Right? So if you need any physio opinion, you can mention physiotherapist. Do not miss follow-up and warning sign. Management plan must include follow-up and warning sign. And you can always offer leaflets, pamphlets to your patient as well, right? So guys, this slide, if you can understand how it works, you will not miss anything in your history taking. Whether it is medicine history taking, surgery, pediatrics, gynae, any history taking, your life is going to be easy. Just this one slide, okay? What do you mean by warning sign? Okay, so if I've got a patient on UTI, I'll say if you have got a high grade fever, if you're having blood in the urine, make sure you come back to the hospital or dial triple line. So that is the warning sign, right? So what are the things that should be alarming? That is what you mentioned as a part of warning sign, doctor. Okay, so that is the main thing. Yeah. Okay, so data gathering you understood, management you understood. That slide is very important. I'm going to share this everything with you, so don't worry about that, right? Just come in the WhatsApp group. How you can come in the WhatsApp group, I'll tell you. Just stay with me. Now, interpersonal skills, data gathering, management, you understood a bit, right? What is safety netting? Safety netting is same as warning sign, doctor. Same as warning sign. How should we do eyes? So you ask the patient, do you have any idea what's going on with you? C, are you concerned about anything in particular? E, is there anything else you are expecting from us in today's consultation? So that's your ICE. Yeah. How long is the webinar? I'm almost done, just 10 more minutes, and then I'm gonna tell you guys about the courses and all. So IPS, what is IPS? What is interpersonal skills? One is active listening. So listen to the patient. Listen to the patient. You know, as I said, I mean, we come from a country, we don't listen to the patient. That's the problem. But here, listen. Another thing. If your patient is talking too much, how are you going to tell the patient, I'm listening to you without interrupting? Without saying anything, how will you tell them that I'm listening to you? We have to show them the signs of listening as well. You know, what are the signs like this? Okay. Yeah. So nodding your head, saying okay, okay. This is very important. Yeah. Signposting as well. So, you know, when you are moving from one part of the station to the other part of the station, you signpost it. What does it mean? I'll give you an example. So you're taking history and you're asking past medical history and you're like, is there anyone in the family, any medical condition? No, doctor. Do you smoke? So, you know, I was asking all the medical questions straight away. Do you smoke? So patient felt a bit awkward. Why the smoking came in between? Why is so eager to know my smoking habits and all? What we do when we're moving from one part of the station to the other part of the station, we signpost it. How we signpost? After doing that, let's do signposting. Okay, John, now I'm going to ask you some questions about your lifestyle, your smoking and alcohol, because it might be related to your case. It might be helpful in making your diagnosis. So tell me, do you smoke? So that's the main way, right? Summarizing, so you can always summarize in the end. That's going to be helpful in making the diagnosis as well. ICE, I can't stress it enough. ICE is your bestest friend in your exam. Do ICE, do ICE, do ICE. Anytime you got stuck, do you have any idea what's going on? It's going to be the best thing that you can do in your station. Okay, your body language and the way you are carrying yourself, the way you are sitting is very important. So body language is very important. You need to show them somehow that these 8 minutes are dedicated to you. If you can somehow prove that thing, that these 8 minutes are dedicated to you, you're gonna pass that station. Involve the patient in the management, check and check. You give the information in small chunks and you check the understanding of the patient as well. Don't give the management in one go. Give it a bit, check if they understood it or not. Give it a bit more, check if they understood it or not. That's the main thing. Respond to the cues, guys. Lots of non-verbal cues gonna come. So make sure you respond to those cues as well. Okay. Safety netting will involve adding patient to different registers at practice. Do we mention that in consultation? Like you will be called for diabetes screening regularly. Yeah, that's fine. You can mention that, doctor. Recording, we will be sharing it to you with you. That's fine. At what point do we introduce ICE? It's up to you. Definitely before the diagnosis, but if you're not able to make the diagnosis, you can do ICE then and there, right? So that we don't seem like you're mixing up. No, it's not about mixing up. ICE, do wherever you want to do. This is a bit similar to OIT speaking. Exactly, you are right. So I'm a bit worried. I get nervous and I miss non-verbal cues. With practice, you will be okay, doctor. Yeah. Okay, so important points is first of all, trust yourself. I know we will be stressed in the exam. That is I mean, that's going to happen, isn't it? But a bit of stress is okay. It's good actually, so that you prepare well. But you should not have too much of stress. You have seen so many patients in your life, just 16 more. I know it's very easy for me to say, but then, when you practice enough, you will be okay. Practice, practice, and then practice. Stress is a good motivator, that's true, but it should not be too much that it affects your, the way you work, right? In the exam, trust yourself, be strong mentally, right? Use small sentence. Whenever you prepare for IELTS or OET, our instructor used to say, use complex sentence and then only you can get high score, isn't it? Here in this state, in this PLAB-2 exam, I would say go for small sentence. Make it very easy and clear for yourself and for the patient. Use small sentence, right? Be confident and not overconfident. Be confident. Practice in front of the mirror. We have to be very careful with our facial expressions and all those things as well. So what you can do, maybe first 2 weeks or so, practice in front of the mirror. When you practice in front of the mirror, you will see you will improve a lot more. So practice in front of the mirror. See yourself. You may hate yourself for first 1 week or 2 weeks, but then you'll start loving yourself. Record your consultation and listen to it. That's very important. Reassurance, trust your language skills. A lot of people, they say, oh, I'm not good with my English. Come on, you have passed your English exam. You are good to go. So don't challenge that. Trust your language. And relaxed minds can do wonders. That's true. That's true. Right? Accent, don't worry about the accent. Don't worry. They speak very clearly in the exam, so you will not have any trouble in understanding their accent. They are very clear. Okay. What should be the timeline to choose for the exam? How many months? Gonna come to it. What if anybody stuck due to the language barrier? They won't, because you passed your English exam, isn't it? So don't worry about that. Is it best to give OET after PLAB-2 or before? Why? So you have to, you don't need valid OET when you appear for PLAB-2. And once you're done with your PLAB-2, you passed your PLAB-2, you can use that for GMC registration, right? Will they have Scottish accent? They might have, doctor, they might have, but then don't worry, you will be able to understand that because they speak slowly, clearly, right? So, yeah. And they don't mind if you ask them to repeat it, they'll be happily repeating it for you, right? So, doctors, that is it for me in today's session, right? So, now I'm going to tell you a bit about the PLAB-2 Aspire Academy as well, and the discounts that I'm having for now. And we're gonna have big discounts. Just hear me next 5 minutes, right? So thank you so much, guys. Can we have the access of this lecture? Yes, of course. Yes, of course. If you come in the WhatsApp group, and this is the link, this is the QR code. If you scan it, come in the WhatsApp group, I'll be able to share this PDF and the link for this webinar as well. Okay. So, and stay with me. Don't go anywhere. Just stay with me. Have a good day. Yes, doctor. You too. Is it that nowadays we can use OET certificate for more than 3 years? Yes. So, for now, when you give your PLAB-2, that can be used as your English exam as well. So if you register yourself, after passing PLAB-2 with the GMC within 3 months, you don't have to give your OET again, right? So that's how it is. So now, what are our courses all about and how it works? Yeah. So I'm going to tell you quickly. So First of all, we are the only academy we do live classes, live in person. You'll be sitting in the class and we are doing in person live 12 days, 12 days. That's the thing. Nobody is doing that. Everybody's just doing recorded stuff and all, but we do live classes. So you can attend those live sessions from the academy when you are in the UK. Right. And if you are not in the UK, you can attend those live sessions online as well because all these classes are live telecasted. My advice is attend the classes twice. Once online when you are in your country, then prepare a bit. When you come to the UK, attend it in person. Do I need to pay separately for it? Not at all. Not at all. Just once. Yeah. Are we allowed to write or take notes? Not really, doctor. No, they don't give you pen and paper. They give you pen and paper in some of the stations just to draw something, but otherwise, no pen paper. No pen paper. Right. So I'm in London. So you don't do the classes in London, right? So we do it in Blackpool only. So if you are in London, attend our course live online. The whole 12 days is going to be live telecasted. So what you can do is you can attend it live, right? So do that. Is there any class in Birmingham? We are in Blackpool, doctor. So if you are in Birmingham, you are in London, you are in any other city, you are in any other country, attend it live online. All the 12 days they are live telecasted. We use very good audio video AV system, audio video, so you will not have any trouble through Zoom like the one that today you are attending. So it's going to be like that. So the class, and you will see we are going to be practicing as well. So we're going to practice it as well, and you will see how the consultations should be done in the exam as well. So those who are in person, they'll be doing the consultation, for example, with me, and you'll be able to see that as well, and you'll see how I can also improve. That's what you can do. Our timings are, it starts from 10 o'clock, 10 to 5 UK timing. So we start at 10 o'clock and we finish at 5. Yesterday was our last class for the batch. Friday we finished our last batch actually. So this is how it is. So my advice would be attend the batch twice. Once before you come to the academy, attend it live online, and when you come, you can attend it in person, right? And many candidates, you know what they say, I am not having enough time. I'm not having enough time when I'm going to come in the UK, so I may not be able to attend all 12 days. Okay, so when you have attended live online and you come to the UK and you don't have enough time to attend all 12 days, you can pick and choose. You can pick and choose, isn't it? Okay, I want to attend Simman only. I want to attend only the mannequins one. I want to attend only ethics class. Okay, do that because we do share the schedule. This is the batch schedule. So you can pick and choose whatever you want to attend, whatever you want to miss. No problem. Oh, yeah. So if we pay the fee once, we can attend the classes as many times as we want. Of course, that is it. Also, you will be having pre-recorded videos as well. Now, okay, because live sessions goes live. I mean, so I mean, in 10 to 5 time. After that, it won't be accessible, isn't it? So, but we are having pre-recorded lectures as well. So when you book our course, you're gonna get pre-recorded lectures as well. So you can see those lectures whenever you are free. It is different. Most of the academies, they just have this pre-recorded sessions and that's it, and go and practice. But we have got pre-recorded sessions, plus we have got the live classes as well, and everything is in one package. That is the main thing. So do you only offer 12-day classes and not any 30-day course? 30 days course. So, I mean, you can attend the course twice, so that is 30 days for you. So, and we have got weekly sessions as well. That is also included in it. I'm coming to it. Just give me a sec. So when you book the course, you get pre-recorded videos, and according to the batch dates, you can attend live online. You can attend it in person as well. And what else we have got? We have got you will get the material as well. You will get our booklets, SimMan booklet, examination manual. So we have got the comprehensive materials. You're going to get those booklets from our side. With the course, 2 mocks are included, proper 2 mocks like GMC, 2 mocks, 16 stations, properly that's going to be done. That is also included in the package. Then what else we have got? We have got the weekly mannequin practice, Simman practice, post-course support sessions. What is it? Let me tell you a bit more in detail about these post-course sessions. So what happens? Now you are done with these 12 days. Now how it's gonna go further? So every week we have got the separate sessions as well. That is the weekly schedule for the last week. 12 days batch is going on, but those who have exam next week or the next 2 weeks, they are not in the class. What are they gonna be doing? They can practice on their own. Are we gonna be left just like that, or we have any instructor under whom we can supervise or under whom we can practice? Yes. So for example, last week, this is our last week schedule. So on 30th of June, we had a hands-on mannequin session as well. This is weekly schedule. 12 days is going on separately in the different rooms. You want to attend that, attend that. You don't have enough time or your exam is next week. I don't want to attend that. Can I attend these weekly session? Yes, 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 yes. What happens? Hands-on mannequin. What happens is we take a small batch, like say 24, 30 people. We divide them into 4 groups. Every group will have this one instructor. In every room, you'll be spending 1 hour, and in every room, you'll be learning about 3, 4 mannequins. So in 4 rooms, you'll be able to do all 14, 13, 14 mannequins, whatever we have got. Small groups, small, and you will be doing the session, you will be doing the mannequin. Any mistake you do, the instructor will be able to point that mistake and will be able to correct you. So this is a hands-on mannequin practice. Every week it happens. 12 days it happens, but this is something else. Do you have the access of mannequin 24/7? Yes. If you are living in Aspire accommodation, yes, 24/7 it is available. What else you need? Yeah. Then we have a spam session. What is spam session? It's a self-practice mock assessment session. So what happens is you come from different country. I know people when they come in the beginning, they're like, um, okay, I don't know anybody, how I'm gonna make a group to practice with. So what we do every week, twice, spam. So every week, twice, what we do, we make a group of people. So like, for example, there are 20 people, we make them sit together. Some of our instructor gonna be there as well in that group, and we make them practice with each other. So you practice a station with one candidate, then you change your seat. You practice another station with another candidate, then we change the seat. You practice a third station with the third candidate. In 2 hours, you'll be able to practice around 10 stations with the 10 different people. 10 stations with 10 different people. And you have made 10 new friends so that you can practice with them later as well. That's what we do in this, right? On 1st of July, we had a prescription writing session. So what we do in that? So anybody, so we have got 30 people, 40 people, 50 people, 60 people, we'll make them sit in one room. We'll give BNF to each one of candidate, and we give them a scenario, and we give them a prescription booklet, and we put the timer, time start now, 8 minutes time, and let's see what they do. Once they're done with it, we'll take the sheet, we'll give them another sheet and give them another scenario. So this is also what we do. And then our instructor gonna check that prescription. They'll tell what mistakes you have done and correct it accordingly. So that is the prescription writing session. On 2nd, we did a teaching session. So what is going to happen? We'll be teaching the mannequins as well in one of the session. And then sim and practice. So we'll have a real sim man. So this is a real sim man, guys. If you can see the picture, and Dr. Nikhil is teaching. So this is the sim man. So this is a whole body mannequin which talks as well, right? So sim and practice on the real sim man. You'll be practicing, and the instructor is going to give you the feedback afterwards. So this is how it works. So we have got the 12-day session that nobody is having in the PLAB-2, and we have got these weekly sessions as well. Once you book it, you'll have recorded session, live online classes, in-person classes. This weekly schedule you can attend, you can do whatever you are. I mean, whatever you want to do, you decide, right? So that's how it works. So the post-course sessions actually was the game changer, and a lot of people, I would say, they are actually said it was the best thing that Aspire is doing, right? Hey, my thought exactly, my exam is in November, but I think the pre-recorded lectures would be a lot of help since I'm starting now. Yes, so now in July, you can see some pre-recorded lectures, and in August, maybe you can take part in live online session, and then maybe when you come to the UK, you can attend it in person as well. Yes. Can you share the details about the Aspire accommodation, the pictures and all? There's a website, doctor. There's a website, so I'll share that website, and you will be getting the link for the website in the email as well that we're gonna send it to you. And yeah, so there the website, the pictures and everything we have got there. Yeah. Okay, and please tell us about the accommodation, the charges. Our accommodation charges starts from 18 pounds, and it can go till around 30 pounds, depending on what you want. You want a sea-facing room, you want a double room, single occupancy, triple occupancy. It depends on that. On the website, everything is gonna be there in detail. Yeah. Just to confirm, once I book the full course, can I retake the 12 days course? Yes, yes, yes. Can I attend it once, twice, 3 times, 4 times, 5 times? Yes, 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 yes. Okay, fee. Okay, coming to that. So where is the face-to-face classes? In Blackpool, doctor. In Blackpool. Can we have the accommodation post course as well? Yes, of course, of course. So you can book the accommodation for a month, 2 months, 3 months. It's up to you. You decide. Yeah. Now the course pricing and all, I'll tell you now. So yeah. So our core pricing, guys, it's £649. But if you are a group of 5, you will have £100 off. So you can book the course in £549. So 649, but group of 5 is 549. Now, if you are a PLAB-able subscriber, you don't need group of 5. You can come and we can give you £100 off straight away. So you can book it in £500. If you are a group of 5 and PLAB-able subscriber, you will be able to book it in £529. Another £20 off you will get. How can I make the groups and all? So if you come in this WhatsApp group, the one we have now, and we can ask each other and you'll be able to make the group and that should be fine, right? So yeah, even if the PLAB-able subscription is expired, no problem at all, right? So PLAB-able, they are they are our friends and all. We will get to know if you have ever subscribed PLAB-able. If yes, then no problem, you will be entitled for this discount. I'm in Birmingham and wants to attend the weekend as I have kids. So doctor, what you can do is on the weekends, you can attend these post-course sessions. That's one thing. And you can have recorded videos. You can check that as well. And whenever you're free, come to the academy and we can do things, right? So 529 for a group of 5 in total or each doctor, of course, because what are you going to get? You can attend live classes, in person, online live classes, mocks, 2 mocks are included where 16 stations you will be doing. You'll have pre-recorded videos as well. So everything you're going to have, right? So 649, group of 5, 549, PLAB-able subscriber, 549, group of 5 plus PLAB-able subscriber, £529, right? Okay. Do the academy have the vending machines or something to eat? Yes, yes, we do provide even the tiffin facility as well. So yes, and vending machines, everything you'll have. Yes, yes, yes. If you're online, then how will you attend the mock? For mock, obviously, doctor, you have to come. No, you have to come in person. The mocks are only in person. You have to come in the UK. Course can be attended online, not the mock. If I book the Aspire full course, but I don't live in Aspire accommodation, then it's up to you. We don't mind. That's fine. That's okay. No problem at all. What was the last day to buy the course? It's up to you. It's not about the last day, but I'm having a special offer for you. For 10 of you, I'm going to share it to you in just a minute. How many places, rooms do you have in your academy? Is it for, for staying or what? What is the question? Is it for the course, you mean? For the course, we have got 4 big classrooms, 5, I would say, 5 big classrooms, and we have got mock rooms. So it's a big academy, doctor. The mock runs, yeah, the mock runs, twice or thrice a week and proper 16 station mock we do. Can we book the only mock? Yes, of course. Just email us and we'll be able to help you out in booking only mock as well. If you wish to do that, no problem. Can we subscribe to only post-course post-session? Yes, you can do that as well. Just email us and we will be able to help you in that as well. Yes, 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 yes. What else? Can we take extra mock? Of course, of course. The extra mock charge is £60 and you can take it. Two mocks are included in our full course. And if you want to buy extra, of course, of course. Right. What's the price of each extra mock? £60, doctor, 60. Once you book this course, we don't need a separate pre-record live. No, it's there. When you book the full course, you will be given the material, the recorded course, everything is going to be given to you. Do you have the course monthly or how many courses a month? So we have got the courses, roughly 2 courses in a month, right? So the dates are there on the website and I'm going to share the dates with you guys. So I'll tell you, for example, when is the next course date? Let me just open my website. So for example, and guys, just stay, I've got special offer for you guys. Are the Simman mannequins new? Yes. Our Simman is better than the GMC Simman. That's what people say. Right? So yes, it's new and it works properly. Yeah. So for example, our next course gonna start, guys, on 14th of July and 14th to 25th of July. And the next course afterwards is 4th of August. After that, 25th of August, then 15th September, then 6th of October, then 27th October, then 17th November, and 8th December. So these are the dates, I've got on the website, right? We can email you that as well. That's not a problem. So usually what happens is we usually recommend like you attend live online class first, live online, right? And prepare in your group, maybe when you are in your country. When you come here, you can attend live in person and then spend few weeks where you give the mocks and you are good to go, right? That's the main thing. Yeah. Now, what I was telling you, I've got some on-spot offers as well. So, first of all, join the WhatsApp group if you have not joined. That's really important because if you want, like we shared the things with you, this PDF and everything, I'll be able to share only through this WhatsApp group for me, right? Okay, so what is the price of the course? 649, group of 5, 549, PLABable, 549, PLABable plus group of 5, 529. But for 10 people, I have got a special discount only for first 10. I don't know who's going to be these first 10. They're PLABable subscriber, they're not PLABable subscriber, it doesn't matter. Just for 10 people, if you book it now, only 10 coupons we have released. This is your discount coupon, Aspire on spot 0725. If you book it, you will be able to book the course in £499. Flat discount of £149, £150. So £500 of £499 we'll be able to book. You don't need anything else. You don't need group of 5. You don't need anything, but only for first 10 people, right? So anybody want to book now, you can book it, right? Only 10 coupons we have released, not more than that. So if you want to book it now, just go and book it, right? I'm just checking now. I'm here for next 10 minutes more. If you want to book it, just book it now. I'm not in the academy accommodation. What time or days do I get the access to the practicals? Doctor, you'll get the access of the academy daily from 9 o'clock till 7 o'clock, 10 to 7, if you're not living in our accommodation. Otherwise, those who are in our accommodation, they're getting the access the whole time. What support do you offer post-PLAB2? So first of all, post-PLAB2, what we're going to have those post-course support session. So every week, what we're going to have, a prescription session, assignment session, 2 mannequin sessions, spam sessions, and the mocks. That's going to be happening. So, I mean, these are the support. That's what we can give it to you so that it's going to be helpful, right? What is the validity of the course and what's the ideal time for 12 days course? The validity till you pass, yeah. And what's the ideal time for the 12 days course? I would say first online live, you do it as soon as possible. Do it now. Do it now. So that you can understand what is this PLAB2 all about. Now, okay, my exam is in January. Should I start now or not? Of course, yes. Why not? So start now, attend it live online. You get a bit of idea how this exam works. And then you'll have the material as well. Any updates we do, we'll be keep sending to you as well. So what you do, you just keep yourself updated and it's going to be easy and you don't feel overwhelmed when you see too many things happening, right? So the best time is do it as soon as possible. Don't delay, do it as soon as possible, right? And maybe in person, you can attend it later and then you have 6 to 8 weeks after the in-person course. That's the best thing, I mean. Yeah. So try doctors, this Aspire on Spot 07, only 10 coupons are there. So let's see who's trying. I think one of the Dr. Sanna Goel, you were trying to book it, but you didn't book it. Yeah. So just try. You can actually, only 10 people can book it. Right, so what's the validity that's done? So doctor, do we get discount even if we have only PLAB1 and also got, yeah, of course. So if you're a PLABable subscriber, you get the discount, but this discount is for everybody and you can just get it in $4.99. Only 10 coupons we have released. Is there any practical package? Yes, doctor. If you want only the practical session, this post-course support session, we have got a package as well. That is with one mock. It is £199. Just email us and we'll be able to share that thing with you. Just email us at info@aspiretoclub.com and we will be able to share the more information, right? Okay, so once we get the full package, do we need to sign up for the 12 days batches or can we just show up whatever? Yes, of course. Just email us maybe that I'm going to attend this batch in person so we can make the arrangements accordingly. Otherwise, no other formalities, nothing else. And our full batch, full course includes everything. Everything means live, online, in-person, online, recorded, mocks, spam sessions, weekly practice session, everything is included. You don't have to subscribe anything new, anything more, nothing else. Yeah. So if I applied for the course online and the materials are recorded and are going to be accessible anytime, yes, yes. For how many months till you pass, my friend? The online material is gonna be available till you pass. Yeah. Let me just pause the recording, guys. Stop the recording, I think. Yeah.